Alright, would you be able to guess what birth defect affects an estimate of 166,000 individuals in the United States? What if I told you that this specific birth defect is found in 1,500 kids to 2,000 babies every year in the United States? Or that this birth defect is the most common permanently disabling birth defect in the United States? This birth defect is called spina bifida. Spina bifida means split spine. Spina bifida happens when a baby is in the womb and the spinal column is not closed all the way. Every day, about 8 babies born in the United States have spina bifida or a similar birth defect of the brain and spine. What causes spina bifida? No one knows for sure. According to Dr. Laura E. Mitchell, PhD, the causes of this disorder are heterogeneous and include chromosome abnormalities, single gene disorders, and teratogenic exposures. However, the cause is not known in most cases. There are 4 types of spina bifida according to the Spina Bifida Association. The 4 different types are occult spinal depression, spina bifida occulta, meningocele, and myoluningocele, which is also called spina bifida cystica. Occipital spinal diphrasm is the first type. Infants with this have a dimple in the lower back. Not because most babies with dimples do not have OSD. A doctor has to check with the testing to be sure. Other signs are red marks, hyperpigmented patches on the back, tufts of hair, or small lumps. In OSD, the spinal cord may not grow to the right way and can cause serious problems as a child grows up. The second type of spina bifida, occulta, is called the hidden spina bifida. The reason why is because about 15% of healthy people have it and do not know it. SBO usually does not cause harm and has no visible signs. The spinal cord and nerves are usually fine. People find out they have it after having an x-ray on their back. It is considered an incidental finding because the x-ray is normally done for other reasons. However, in a small group of people with SBO, pain and neurological symptoms may occur. The third type is meningocele, and this causes part of the spinal cord to come through the spine, like a sac that's pushed out. Serve fluid in the sac, and there is usually no nerve damage. People with this condition may have minor disabilities. The fourth and last type is myelonmeningocele. This is the most severe form of spina bifida. It happens when parts of the spinal cord and nerves come through an open part of the spine. It causes nerve damage and other disabilities to 79% of children with this condition also have too much fluid in their brains. This happens because fluid that protects the brain and spinal cord is unable to drain like it should. The fluid builds up, causing pressure and swelling. Without treatment, a person's head grows too big and may have brain damage. With spina bifida, there are chances of many to minimal complications. According to a study at the Mayo Clinic, spina bifida may cause minimal symptoms or only minor physical disabilities. If the spina bifida is severe, it can lead to more significant physical disabilities. The first complication is orthopedic complications. This means there could be a problem in the legs and spine because of weak muscles in the legs and the back. The types of problems depend on the level of the defect. Possible problems include a curved spine, abnormal growth, or dislocation of the hip, bone and joint deformities, muscle contractures, and other orthopedic concerns. The second complication is bowel and bladder problems. This means nerves that supply the bladder and bowels usually do not work properly. This is because the nerve that supply the bowel and bladder come from the lowest level of the spinal cord. The last complication is accumulation of fluid in the brain, or better known as hydrocephalus. This is where babies are born with too much fluid in the brain and could enlarge their heads. If it is an extreme case, a shunt may possibly be surgically inserted into the brain and help drain the fluid through intestines and into the stomach. Open fetal surgery may help find spina bifida children. Mothers who qualify can have the surgery at 25 weeks of pregnancy. Fetal surgery is a procedure performed as an inpatient surgery. The mother will receive medications to prevent preterm labor and antibiotics to prevent infection. The procedure is performed with general anesthesia and a cesarean-type incision made in the lower abdomen. An incision in the uterus is made at the level of the lesion of the fetal spine. During this procedure, anesthesia to the mother is used to keep the uterus relaxed, as well to provide anesthesia to prevent pain to the baby. The uterus is then opened up and a spina bifida lesion is exposed. The baby remains in the uterus the entire time and is given anesthesia and pain medications as well. The pediatric neurosurgeon will open the area surrounding the defect, cover the defect in the spinal cord with the dura, and then create skin flaps to cover the skin defect. The procedure may take up to 2 hours of anesthesia for the mother. Post-surgery requires mandatory bed rest until the next scheduled operation, which is a C-section at 37 weeks of pregnancy to give birth to the baby. Hopefully the mother doesn't go into labor before that time frame, but it could happen. Fetal surgery may reverse the malformation that may cause problems with breathing and swallowing. According to a study at the University of North Carolina Women's Hospital, research shows that approximately 14 to 35% of children born with spina bifida do not survive by age 5. That is in extreme cases, but fetal surgery can decrease the percentages. Before I conclude this speech, I would like to provide you all with one more fact proven in a study. According to the National Institute of Health, 68% of unborn children who are diagnosed with spina bifida in utero die from abortion. Most babies are aborted before the gender is revealed to the parents. Spina bifida is not an absolute end to a great quality of life. American singers such as John Mellencamp and Hank Williams Sr. both have spina bifida, and look at their success in life. This concludes my informative speech. Thank you.